Three, go.
Hi, I am sarowar, student of National Medical College, now doing internship. Today I demonstrate the examination of specific part of general examination. In the first video, we see the examination of general examination, whole part of general examination. Your professor may ask you to do the specific part of general examination, such as look for anemia, look for jaundice, look for clubbing, look for cholionicia, edema, dehydration. So I started my examination with jaundice. Before I start examination of jaundice, you must need proper daylight to demonstration of jaundice, because jaundice is better observed in the broad daylight. To make it fail for this reason, so take it note that you have to examine jaundice in proper daylight. You have to need proper daylight. So we started examination of jaundice. Where we see the jaundice? Upper bulbar sclera, ha koren, jibba ulta koren, dorsal surface of the ventral surface of the tongue or under surface of the tongue, palmar surface of the hand, and sole, and overall skin. So where we see jaundice? Upper bulbar sclera, under surface of the tongue, palm, sole, skin as a whole. Now examination of jaundice, examination of anemia, where we see the anemia. In case of anemia, we see the anemia in lower palpebral conjunctiva, ha koren, jibba ber koren, dorsal surface of the tongue, upper surface of the tongue, palmar surface of the hand, and sole, and overall skin. So where we see the anemia? Lower palpebral conjunctiva, dorsal surface of the tongue, palm, sole, skin as a whole. Now examination of clubbing. If you get in general examination, if you see the general examination part, I see only the nail angle. In general examination, if you get the disappearance of nail angle, it is the first stage of clubbing. So you have to go to further examination of clubbing. Now I examine for clubbing. For clubbing examination, the first stage of clubbing, the first stage of clubbing, disappearance of nail angle. Just take the nail in your eye angle. To see the nail angle, it is normally 150 degree. If it is disappear, then it is the first sign of clubbing. And fast clubbing develop in the thumb, and fastest develop clubbing in the lung disease, suppurative lung disease. So here examination of clubbing. First see the nail angle in your eye level, then the sponginess in the nail bed. How you tested this? Your middle finger should be in there, and thumb in there, and your index finger in there, and other finger just watch. Push through this finger and feel by this finger. So push it and feel it. And it is the second stage of clubbing, sponginess, increase sponginess over the distal phalanx. And then we see the window, Shamroth window. Shamroth window, how we perform it? You should demonstrate it to your patient. Do this. You see the gap between the two fingers. It is called Shamroth window. It will disappear in case of third stage of clubbing. And the fourth stage of clubbing, you get parrot peak appearance of the nail. Tia pakhi thoter moto. And in fifth stage of clubbing, you may not done this because it's too much complicated. Hypertrophic osteoarthropathy. So you should done 4 stages of clubbing, such as disappearance of nail mangle, you observe in the eye level. Then sponginess in the distal phalanx, then Shamroth window, then parrot brick appearance. So this is all of examination of clubbing. Examination of cholionicia. Cholionicia have 3 stages. You have to examine the nail in your eye level. Then in first stage there will be beetle and dryness of the nail. Nail will be dry and beetle in first stage. In second stage the nail will flattening of the nail. And in third stage, the nail will convex and spoon-like. So examine this cholionicia. It's all about cholionicia, and now we go for examination of edema. In case of lying patient, we see edema over the sheen of the tibia, just above the medial malleus. Just above the medial malleus, over the sheen of the tibia. Compress about 10 to 15 seconds, hold it, and release it, and see for pittingness. And in case of bedridden patient, we see edema over the sacrum. Use your 3 fingers and press over the sacrum and push it about 10 to 15 seconds, and release it and see for pittingness. And now we go for dehydration. It's important to see the dehydration. In dehydration, you made sign of dehydration such as shrunken eye, dryness of the tongue, dorsal surface tongue may be coated or dry, you say dry tongue, and then skin pinch. In the abdominal flank, you just raise the abdomen and raise the skin over the flank and release it. It should go, in normal person it should go within 2 seconds, but if it's delayed to go, such as it's called slow, skin pinch go slowly. So we see shrunken tongue, dry mouth, skin pinch go slowly, and then we see the pulse, rapid 3D pulse and low blood pressure. Rapid 3D pulse and low blood pressure is a sign of dehydration, and you also may get the postural drop. So it's all about and then we end with the examination, specific parts such as in this part we demonstrate the examination of lymph nodes. For lymph node examination, we have to examine the 3 major group of lymph nodes. 3 major group of lymph nodes: cervical group of lymph nodes, axillary group of lymph nodes, and inguinal group of lymph nodes. So we started with cervical group of lymph nodes. Cervical group of lymph nodes. Submental. You have to palpate this lymph node by your palm of the finger, not like this. You have to feel like through your palm of the finger. So we started with submental, submandibular, jugulo-digastric, anterior cervical chain, scalene, and then supraclavicular, then posterior chain, then preauricular, then postauricular, then occipital. And now examination of axillary lymph node. In axillary lymph node, we got 5 group of lymph node. Just put your hand here and examine the 5 group of lymph node. Anterior group of lymph node, apical, lateral, central. Anterior, apical, lateral, central. We have to examine the posterior group of lymph node from back, and in this hand we examine anterior group of anterior, apical, lateral, central, and posterior group of lymph node examine from back. Posterior group of lymph node examine from back, and then examination of inguinal lymph node. Examination of inguinal lymph node. Inguinal lymph node, just palpate here. Groin, palpate here in groin. You also may get epicondylar lymph node, para-aortic lymph node, and popliteal lymph node. But if you must complete the 3 major group of lymph nodes: cervical, axillary, and inguinal lymph node. So it's all about examination of specific part of general examination. Thanks for watching.